Hey guys, it's me, Lily. I'm back. Woo! So, I just washed my hair. So come get ready with me. Woo! Come get ready with me. So I am loving the short hair because it's so much easier, to handle than having like long hair. So, I don't have the time to do my hair every day or all the time. I'm too busy working or taking care of my babies, At the same time, I can never neglect my own self, all right? Psychiatry 101. But I want to stop by here to make this video and to remind you, whether you're a patient or just a person who's just looking into getting help for psychiatry, whenever you schedule that interview, that appointment with a psychiatrist or a psychiatric MP, I want to remind you to please be honest. Be honest whenever we ask you questions. Like I tell my patients, this is a judgment-free zone, and it really is. Like, I'm on your team. Like, you tell me anything, I'm gonna support you. Like, that's what I'm there for. For example, things such as, have you had or have you been prescribed a controlled substance in the past 30 days? If you're coming to me for panic attacks, FDA-approved medications are benzodiazepines. First line of treatment for panic attacks, panic disorder, is a benzo, whether it's a Prazolam. Some of them actually take lorazepam too, which aka Ativan. So please be honest. Don't say no, because before we prescribe a controlled substance, we have the duty to go on the website, the DEA, Drug Enforcement Administration website, and check your history. And we have to verify that whatever it is that you're saying, even though we believe you, it is true. And no provider can actually prescribe a controlled substance without checking that first. Otherwise, they can get in huge trouble with the DEA. And it's not safe for you either. So for those people who are like going to jumping from provider to provider, like they go to an urgent care today to get Xanax, then the next day they make an appointment with me to get Xanax, and then you tell me on my face that you haven't had a Xanax and you haven't been prescribed a Xanax in months. I want to tell you that you cannot fool me. You cannot lie to a psychiatric provider, let alone fool the DEA, the DEA knows what I have for lunch today, okay? Like, they have databases, they track these for a reason. So at the end of the day, I am here for you. I do want to help you if you have panic disorder, but I cannot help you for misuse of controlled substances. That will never happen. So just keep that in mind, that before you try to pull that off again, we know what you're up to. And just be honest. I mean, sometimes it's not really that you want to divert it, like in this case, but sometimes patients go to PCPs, and the PCPs don't feel comfortable prescribing Xanax more than once a day, PRN, or more than a week. And that's where us psych providers come in. But, maybe your dose needs to be adjusted. But say that, and we will definitely appreciate, understand that, help you. Because at the end of the day, we want to help you get your quality of life back. And I want you to have a good quality of life. I will never want any of my patients suffering, especially when there are medications for that. Okay?